Erin Hudson is a person that I met about 6 months ago, and I started talking to her, and she's from New Zealand and what she's doing in New Zealand. And one of the things that she is doing is sort of dispelling the myth of these diseases, and I actually don't like to call them diseases, these childhood illnesses that we have been sort of feared into and made to be scared of. And she has created a six-hour sort of community information piece called Authentic Resistance that goes through those different diseases, goes through kind of what you can do, and you know, disease isn't good. You know, we don't want to get sick, but if you do get sick, and actually many of the childhood illnesses, there's proof that it's better you can get sick and get healthier, and your immune system is boosted and other things are boosted. But basically to take away that fear. So Erin has taught for almost 2 decades at the South Pacific College of Natural Medicine. She's got over about 25 years of clinical and massage experience, and she specializes truly in the sort of pregnancy all the way through the first piece of life. And that is the time that, you know, we are bombarded by the doctors of get vaccinated, get vaccinated, get vaccinated. And so if you don't vaccinate, what do you do? What are you looking for in the symptoms of diseases? And chickenpox is an interesting one because it's the last vaccine that's come on board for childhood, in the childhood schedule, the varicella vaccine. And so it has had some interesting cause and effects in doing that. And I'll let Erin speak to that, but I'm thankful that she came all the way from New Zealand and to share this information with us.
Thank you, Christina. So, late night conversations when you've got a presentation to think about. Christina and I came up with a name. Christine, Chickenpox Parties and Bring Your Own Shingles. Because we have this idea that if you want to get chickenpox, you just go to a party. What a great idea. But in actual fact, it's only a great idea if you need to have that invitation. So we'll talk about that. So kia ora tātou, greetings from the long white cloud, which is New Zealand. And it's really, really a great privilege to be here. What we're going to talk about in the next 40 or so minutes is getting ready to go to the party. Because if you're not ready, if your skin's not good, it's not a good idea to go to the party. So I'm going to talk a little bit about protecting the microbiome and bringing in this factor of human milk again. Human milk is perfectly designed for humans. So keep that in mind when we talk about the basic nursing cares and also as we look at some of the symptoms and some of the treatments for chickenpox. So I won't go over this slide because we talked about this in my first talk, but the course Authentic Resistance is just simply for families to dissipate fear, to gain confidence from talking with other parents who have chosen not to vaccinate, and it's also a time to support families through any of the childhood diseases that they have so that they've got someone as a go-to. I've had previous occupations, as you can see, and all of them have led to this point, which is working with families throughout this really important time of their lives. So believe it or not, going to a chickenpox party starts pre-conception, so that's really good planning. Making sure that there's a healthy diet, and when I talked about fear earlier, I find that fear starts actually in pregnancy with women being told what they can and can't eat. If you eat this, something might happen to your baby. If you don't eat this, something might happen to your baby. So I've written there, eat what you enjoy. And I think most women, when they do get pregnant, especially the first time, it might be the very, very first time that she starts listening to her body. And avoiding fear, especially avoiding fear with a baby growing, is a really sensible way to start moving through having a good microbiome. And the commonly accepted belief that a baby is sterile inside the uterus is now being challenged. And we know that the maternal gut microbiota is actually transferred over to the baby in utero and then, of course, supports them when they're born. Pregnancy is not a good time to have any antibiotics, especially if there's already an underlying candida or thrush concern for that mum. And so really finding other things that you can use instead of antibiotics is ideal. Otherwise, that baby is already born with a disadvantaged skin at the beginning. I also encourage families pre and post-conception to start looking at their natural immunity research. And instead of talking about vaccines, I try and flip it and say, study natural immunity. Have a look at some of Suzanne Humphrey's clips on neonatal immunity, which there's 6 wonderful clips for families to get really in-depth knowledge about how natural immunity works and why, in fact, vaccines aren't necessary at all. Vaginal delivery is ideal for everybody, mum, baby, and also the rest of the family. And also breastfeeding is ideal for baby. And I've specified baby there because actually it's its right. It's its right when it's born to have access to human milk, the milk that was designed for that baby. And having any other type of feeding, even though it might be required for some families, is really not ideal. And I'm happy to say that. It's just not the best food for them. So, birth and beyond. Once that baby's born and that feeding is established, even the WHO tells us, the World Health Authority, that the best way of looking after your baby is to breastfeed for the first 6 months. Now, if for whatever reason baby's been born by caesarean section, that it's critically important that that baby has some probiotics. Yes, they're getting it through the breast milk, but also amplifying those probiotics through a good quality supplement, using probiotics as well if the baby needs to have some formula feeding. For some families, they'll say to me, I think I might breastfeed for about 8 months, like it's a decision. And so I always say, why don't you breastfeed through the second winter? Whenever that winter is for your baby, whatever age your baby is, because the first winter they're very close, they're tiny, they're right next to you, but that second winter is when they start to crawl, eat flies, kiss shoes, and do all sorts of things that they might not have done when they were close. So having it be that you get through that second winter having probiotics on tap, human milk on tap, nurturing love, comfort on tap when that baby's unwell is a really critical part of ensuring that baby's immune system is ready for beyond that 2-year period. So I've worked with lots of families over the last 30 years, and this is just a snippet of what some of the things that they tell me about breastfeeding. And I have to say that some of these are written by men, and I think you might be able to spot those ones. So when you're using breast milk as a medicine, breast milk as a nurturing, pathway for your child, it's very, very family friendly. Don't have to leave home, obviously. But it's got all sorts of flavours. So when a baby has breast milk, they get, if mum's had curry, if mum's had chili, if mum's had a range of vegetables, if mum's had a range of different foods. And so they get to have all these tastes all the time. If they're not having breast milk and they're having some sort of supplementary feed, then it's like having the same meal every day for 6 or 7, 8, 9, 10 months. So when that child is then introduced to different foods, they're like, well, actually, I'm used to beige. Beige is my favourite because that's what I'm used to. So when you've had breast milk, you've had exposure to all sorts of different tastes and flavours, and that reality about trying different types of food as a baby, as a toddler, is probably a little bit easier. Another good thing about breastfeeding is it's really, really easy to store between pregnancies. And also you can recycle them for future use. But coming back to the immune properties, that every single mouthful that baby takes has some immune property with it. Even the 3 or 4-year-old child who's breastfeeding, every time they feed, they're getting some good quality nutrition. And it's interesting because if it's a hot day, the milk gets thinner. If it's a cold day, the milk gets thicker. If it's winter, summer, the milk changes. If it's a young child, an older child, and also feeding a baby, the milk changes for each baby's saliva. If that baby was to go and kiss auntie and get a germ and come back and feed, the saliva from that baby's mouth will go into the mum's breast, into her Peyer's patches in the gut, And within 3-4 hours, by the time that baby comes back for the next feed, mum has got antibodies ready for those germs that was introduced 3 or 4 hours earlier. So it's absolutely 100% amazingly magic. There's a book called Milk Matters, which is massive, and it's written over 40 years with feeding wisdom by an Australian anthropologist. She claims it should be an essential text for all health professionals and a required reading for all medical and midwifery students. Because in fact, breast milk is alive. There's no other food like it, and you cannot reproduce it in any sort of way, even though we are told that there are perfectly good substitutes. The reason why breast milk is so important is that it helps with something called gut dysbiosis. And Maureen talks in her book a lot about alternative feedings, which pose unrecognised risks, and they also have transgenerational effects, including the emergence of immune disorders. She's often consulted by women who are not breastfed and who are now starting their families and having difficulty with their baby's immune responses and some allergy pitches. So some of the symptoms if there's gut dysbiosis in the breastfed baby or even in the formula-fed baby are things like thrush, allergies, any skin problems, poor immunity, poor digestion, and especially poor recovery from illness and symptoms associated with the malabsorption of nutrients. The risks of having gut dysbiosis includes that you're going to have more likely to have used antibiotics in your pregnancy and postnatally, more likely to have had caesarean birth, in which case every woman has 1 dose of antibiotics post-surgery, whether she knows it or not. Every woman's had it. And often formula feeding will be the first sign that the gut is not happy because that's introduced as a different type of food. And when babies are given solid food too early, and that's especially grains, that can also cause some gut problems. So how do we heal the gut? We've got 2 avenues here, one for baby and one for the adults. So again, avoid unnecessary antibiotics. So I'm not sure what it's like here, but we do have families in New Zealand who go to the doctor for every single problem, and the expectation is, can I have the antibiotics? Then we can go back to work and our life will go back to how it was. What can happen though is that first lot of antibiotics just don't work. And so the doctor says, that's okay, we've got more. So we try another one. That doesn't work. That's all right, we've got a few more. Try another one. And I've worked with families who've had 8 or 9 month old children, and they've had 8 or 9, sometimes more, lots of antibiotics before I've seen them. And you're shaking your heads, and that's what happens to the mums. They're shaking their heads. They're like, but I've been there and I've done that and nothing has changed. So what happens is we have to not only change what's happened in the gut simply because of the antibiotics, but we have to then repopulate that gut with the good bacteria so that you don't get back to that disadvantaged state. So breastfeed if you can, and we have quite a lot of acceptance of donor milk now. So we've got families who have been tested through their pregnancy and they know that they don't have hepatitis B, they know they don't have HIV, and they're more than happy to donate their milk to families who either aren't feeding or to families who've got sick children and they want to just replenish the stores so that that baby can be looked after. Most important thing to do if the baby's already on solid food is to take away any of those factors which help damage the gut. And I know that sugar, we mention quite, blasé sugar, but sugar's probably the most detrimental thing, refined sugar, that you could possibly give your baby. In fact, I've read some studies that shows us that sugar, more than anything else, is the gateway drug. Sugar is the beginning of seeking out stimulation. It's the beginning of needing that brain activation. And although, that next look might be some other type, like whether it be alcohol or further, that's actually the first thing that we want to stop their brain be excited by. As we take things out, it's always really important to show families what you can replace with. So all the high quality, good healing foods for the guts like kefir and fermented vegetables and bone broths. They're ideal, and I checked with Sally yesterday and she said from about 6 months on, babies can start having the bone broth included in their normal diets. You can rebalance with probiotics, but what can happen is a family will start with one lot of probiotics, and then after 3 or 4 months they'll be like, I'm not sure if my probiotics are still helping. So it's like you need to change, replenish, recycle, and constantly keep those probiotics there when there's still an issue, so that the body can have a huge diversity in their gut and not just simply one strain. And anything to do with guts, to do with cell metabolism, to do with, restoring, to do with regeneration, strength and healing, needs to have an increase in that intake of vitamin C. So not vitamin C that you're going to end up uncomfortable in your tummy, just enough vitamin C either through those food sources or coming into a very simple, perhaps once, maybe twice a day dose of sodium ascorbate to keep the levels up in that child's system. If they've got problems with their skin, then they also can have that vitamin C used as a paste on their skin, like with an eczema, or you can use it as a spray on the skin using the ascorbic acid. Healing the gut is very, very similar in adults, and often they won't use antibiotics unless they absolutely have to, but you can find that there's so many other things to use instead of antibiotics, especially for acute inflammations. We've got pictures and lots of stories from New Zealand with families who have chosen not to use antibiotics for quite serious skin diseases and also quite serious chest problems. And we've got some amazing photos of the healing that's gone on. So again, take out the things that are damaging, replace with the things that are helping. And as far as supplements go, it's essential that people get good quality supplements. So not from just the local supermarket, but going to a good quality supplement place so that you can ensure that you're getting the nutrients you need. So when you have antibiotics in both young and the older person, one of the things that can happen is the gut permeability and the function changes. So if you've got a change in that microbiome, you want to make sure that you have everything in place before you go to a chickenpox party. Otherwise, the outcome and the severity of that chickenpox, and for adults, that shingles, is actually going to be extended. So, while you wait for your invitation, I would suggest you do some reading. And although specifically this book isn't about chicken pox, it's a very long read. So I recommend that you use this book as a way of ensuring that you've got all the information about the history, all the information about normal disease, so that when someone says to you, what, you're going to a chickenpox party, how irresponsible of you, you can actually have the information that you can share with them to say, I'm not afraid or I'm not scared, and I've read enough to know that what you know about smallpox, what you know about polio, what you know about all these other things is actually incorrect, and what I know is what I'm basing my decision on if I'm going to actively seek out to have a childhood illness. So because I was coming to America, I went onto an American website to find out what you would get if you were Googling to see what you would do for chickenpox. And it's kind of strange to see that they tell us here that there are, what does it say? That it doesn't seem to, like when children have got an immune system that's not working very well, then it's not a very good idea to go and seek out chickenpox. And also, before the age of 1, their mothers, if they had chickenpox themselves, they would be passing on those antibodies through the breast milk. So that brings us to the thought of if someone hasn't had chickenpox naturally, they've been given the vaccine, that when they have their families and breastfeed, they're actually not going to be passing over specific chickenpox vaccine, chickenpox antibodies, although they will still have the benefits of the breast milk itself. This site also tells us that it's rare because of the chickenpox vaccine, and that's a shame, because if we had more chickenpox circulating, as you'll see later on in the presentation, we would also have less shingles. The other thing that this website tells us is that you shouldn't be using ibuprofen. and I'll show you soon why not. Partly because of the fact with any disease, especially a skin disease, is that you want it to manifest and then you want it to express itself and come out as it should. Naturally progress. One of the things with ibuprofen is that it doesn't allow it to naturally progress. In fact, it pushes it back into the body with some horrific results, in fact, some deaths. The third thing that I found out from this website is that if you've got any problems with any sort of pain, then you just give them something which is sugar-free. So immediately sugar-free to me says, if it's not got sugar, what's it got? Well, it's got this lovely excitotoxin that, as we know through Russell Blakelock's work, that no way is putting an excitotoxin into your child a good idea. So the paracetamols, the Tylenols, all those sorts of sugar-free treatments, giving them to a child when they're not well is actually including in their system, as well as everything else, an excitotoxin, which is not helpful at all. It does talk about calamine lotion here, and I'll talk about that as well. But in fact, calamine lotion is not the best use of normal home treatments these days, and they have a great deal to do with scarring when people are using it. The third part of this, and the best part for me, is that it includes at the middle here that you should continually hydrate that child, and it also talks about breast milk, which is ideal. Now, sometimes it happens when children have some spots, is that all those photos go onto the Facebook pages, it does in our Facebook group, and they say, what is it, what is it, what is it? And so it's really good to know what it is before you start treating it. Now, this is just a very, very brief comparison for you to see that with the chickenpox, you've got quite swollen, quite red, quite inflamed pustules, and then you've got that white head in the middle, which is coming to sort of a leaky, watery vesicle. It's not got any pus at all. Whereas you've got something quite similar, but very different, which is the molluscum, and some of you might have heard of this virus. But with the molluscum, you'll be able to see that it's very tight, very circular, and in fact, when that little vesicle erupts, it's like a thin, it's like toothpaste actually, a thin sort of waxy, not pussy, but a waxy exponent that comes out of it. So they're quite different, and it's important before you start treating chickenpox specifically that you know which pox you've got. So, chickenpox, the best way to get chickenpox is just to get into a bath with someone who's got chickenpox, but that's not advised. But you can just go to a party, you can just hang out, you can just touch, you can just cuddle, and you can just have anything to do with the vesicles of the skin, and that will most likely cause a chickenpox reaction within you. It often will present with a fever, but it doesn't have to. And the spots, as I said, they can have a little blister on top. The rash is mostly on the back, but it can also go up into the face and up into the scalp. Now, I think the most uncomfortable part to get any chickenpox is up and around the eyelids, in and around the lips, in around the ears, and especially around the foreskin and the vulva. Very, very uncomfortable for probably 12 to 24 hours because that's a moist area, and it can be really, really itchy, which is the worst place to itch. The spots will usually crust over within 24 hours, sometimes a little bit longer, and once they've crusted over, they're no longer contagious. And the itchiness can be variable. So some people can be driven crazy with the itchiness, especially as the vesicles leak and they sort of irritate the skin. And then other people will have chickenpox, and one, you won't even know they've had chickenpox, but two, they'll have really minimal itching and not anything that needs to be treated. So orally, for chickenpox, as I talked earlier, is to keep the child hydrated. Lots of fluids, lots of sips, lots of whatever they want to drink, as long as it's healthy. And using human milk if possible, and it's ideal as a little paste or a paint to put onto the chickenpox vesicles themselves. Sodium ascorbate, as you'll hear this afternoon from Suzanne Humphreys, is ideal for any virus that's going through the system. And it's best to work out perhaps beforehand what your child's individual sodium ascorbate level is, so that when you know it, you can work with that level up into any disease or any illness state. For some children, cod liver oil is recommended, especially if they're photophobic, which means that they have difficulty with lots and lots of shining lights or screens. And echinacea is also a wonderful treatment to start right at the beginning as that virus is working its way through the system. Now, when it comes to the itch, the remedy that I have found the most useful over the last 20 years and works within minutes is the Rustox 30. So it's specifically for the vesicles as they itch and as they drip and as they sort of irritate the skin. And although, you know, some children might not have any itching at all, that's where you may get your secondary infection from. If they scratch, if it gets infected, if it gets red, if it gets inflamed. So it's better that they don't have the itch in the first place. Now, I'm not sure about you. Put your hands up if you had chickenpox. Do you remember it being itchy? And so probably your mum put you in the bath to help with the itch. So we'll get as to why that's not such a good idea. I've got 3 slides here which I've cherry-picked, but they are about ibuprofen. And this slide here talks about the fact that when you're using something like ibuprofen in a severe skin or a soft or like chickenpox, is that you can actually have a lot more of a serious illness than if you didn't use the ibuprofen. In fact, they said that there was an elevated risk of severe skin and soft tissue complications, especially in varicella. In fact, it says for some reason mostly in children with varicella. And that there's no risk of complication associated if that family just chose the paracetamol. Another study about ibuprofen tells us, and this is from New Zealand, that using ibuprofen was more likely to have a result of necrotizing fasciitis, which is a very, very severe complication requiring ICU, and it's often if the child is going to have any sort of damage or scarring, it will be having the ibuprofen use. And if you see photos, which I didn't include in the presentation, what happens is the skin doesn't look like a normal chickenpox. They embed. So they embed into the system, and once they embed and become a secondary infection, then they start to spread. So you can have a whole back or a whole trunk that's pretty much one open sore. And that's because the virus has been pushed back into the body instead of being allowed to be released through the skin, which is the normal way it should come out. The third one is to do with a study where they found that that it's a contributing factor in making sure that, what does it say? It's a life-threatening condition if not recognised and treated earlier, but the use of steroidal anti-inflammatory drugs has been implicated as a contribution factor. And despite any limitations related to spontaneous reporting system, this study indicates a strong association between NSAID and NSTI. The thing too, if you're using ibuprofen, sometimes what can happen is it'll mask the symptoms, which means if you haven't got your right symptoms because you've had this masking, you're not actually sure what it is that you might be treating. Now back to vitamin C, and one of the sources for vitamin C is this afternoon's talk, so that's why Suzanne's there. But the best place to get your vitamin C, whether it's before you get chickenpox or during your chickenpox experience, is to get it through food. So for some children, if they're not well or if they've got a bit of a fever, it could be that you're using juices or you're using smoothies. And ideally, you're getting a sip or 2 at a time, maybe a little bit longer, 3 or 4 mouthfuls, and having that sodium ascorbate as part of that as well. For some families, having the powder is a good way to get the levels up, but to maintain the levels, it can be that you use the lipospheric vitamin C sachets. So you're all quite aware of the lipospheric? So the lipospheric comes in a gel, an oil emulsion, which means you can take the powder to the point that you're getting that bowel intolerance, the bowel rumbling, but to maintain the levels without getting the diarrhea, you start having a lipospheric emulsion, and that way you keep your levels up without actually getting the diarrhea. So for some illnesses, it's that you have both at the same time, because even though you don't want to get the diarrhea, you do want to get the benefits of having that much vitamin C. Now, why we don't always suggest lipospheric early on is because it's very expensive, way more expensive than the powder. So you really want to have it on hand so that you can supplement your dose of sodium ascorbate without having that uncomfortable symptom. For people who don't have any sodium ascorbate at home, they have their calcium ascorbate, or the ester C. Is that a brand you know? That's useful, but it's only useful for short term, because long term you want to stick with the sodium because that's much easier, peed out of the body if you don't need it. And the calcium has that ability to actually calcify some of the soft tissue in the body. So long term it's not your best point. Now, with vitamin C, you can also have ascorbic acid, and that's a wonderful mister to put on the skin when the child gets itchy, because the vitamin C absorbs straight into the vesicle without that sting that it would get from the sodium. So avoiding any sort of pharmaceuticals when this illness arrives is key. The baths aren't such a good idea these days, because as you can see from these vesicles, they're quite open and quite drippy, and they're quite moist. So if you get in the bath with that, one, you've got open pores, open sores, which means your transference of bacteria is going to be quicker. But you've also got the fact that you're changing the pH of that skin. And the pH, if it changes, what happens is if it gets, it needs to be acidic. And if it gets too alkaline, then you've got that ability for more pathogens to actually be on the microbiome on the skin. And that's why having a bath every day with chickenpox is not needed, but applying something to the spots so that they're not itchy, of course, is. Now, coming back to the calamine, if you can see this one up here, that's quite a deep crater. So if you put calamine onto that to stop the itch, calamine is a very, very thin, fine powder. And what happens is the powder sits in that crater, and then as the skin granulates, it only granulates up to where the calamine is. So if the calamine's sitting on top of the vesicle, you're not going to get a smooth finish of that scarring. You're going to get the pitting. So for those of you who had chickenpox a few decades ago, and you've got one or two decent scars that you still can see, it's likely that there was calamine on that crater because it would have been itchier than all the others, and that's what's caused the scarring. We live and learn. So topically, you can apply breast milk to any blisters as they arrive. If the child does want to have a wash, then it's in and out of the shower, because you also want to let the skin sweat. And in a bath, if that child has got a fever, they're not as likely to be able to sweat in the bath. Whereas if they have a shower and they're out again and dried off, they can have the ascorbic acid sprayed all over their body, stand around and be sprayed, and that will reduce the itching, and that will allow those little craters to granulate easily and heal without too much of a scar. Some of the other local things that you can apply to any of the blisters is a baking soda mix. So similar to a calamine, but it's a different type of powder. And instead of putting it on the spot itself, you're better to put it around. So around the area where the irritation and the inflammation is. It'll still be absorbed in, and it will still reduce with the itch. Lavender essential oil is quite nice if they're itchy, but I tend to use that once it's actually popped and it's moved and it's starting to clear, because then it can also, the lavender can also heal the skin as it starts to regranulate. Aromatherapy, for those people who use essential oils, I think the most commonly known oil for reducing scarring would be the rosehip oil. And you can actually use that for a good 3 to 6 months after the chickenpox have cleared up. Most scars fade easily. In fact, you'll have children who be quite heavily scarred at, say, 3 or 5, and especially perhaps on the face, and parents are very concerned. I can assure you that by the time they're 17 and they're out on the town, they won't notice that. In fact, there's an ad that I've seen, and it's of a girl who has a hand on her face, and she has a chickenpox scar here, and it's an ad for plastic surgery. And she says, I need to have plastic surgery, and the ad is for the vaccine. It's like, if only my mother had given me the vaccine, I wouldn't need to have plastic surgery. And I just thought, boy, that's really sad that if one spot on your face means that you're, devastated. So another thing that you can use with any scarring or anything to do with aromatherapy is to put these wonderful herbs into some sort of a bottle and just shake it each time before you apply it. And I think little children especially like it when you dab stuff on them. Like if it's sore, they want something on it. Even though they might be having their Rustox orally for the itching, they still want something on the spots. So that's part of your home nursing treatment. If you do have a wriggly person, then it's quite good to give them a foot bath because they need to sit still for that. And also having a foot bath is a bit of a luxury. It's a bit of a pamper treatment. And part of being unwell as a child or even as an adult is that it's a point of stopping. It's a point of resting. And it's a point of making sure that you heal from that illness so that you can go back out into the world with all those other things. So the question is, apart from the child who has good skin, who else should be invited to the chickenpox party? And in actual fact, the elderly should also be invited, because one of the things that's happened since we've got the varicella vaccine is that we no longer have chickenpox circulating in the community. So socialising 101 means invite grandma, invite granddad, invite anyone who has a possible chance of not having enough chickenpox antibodies in their system, making them at risk of shingles. And the ideal setting is that it becomes that it's normal for people to go out and about and have the possibility of catching some of these diseases and keeping their antibody levels up so that they don't end up at sort of 60, 70, 80 perhaps with that risk of having a bad dose of shingles. I love this little photo, this little chap teaching grandma, because quite often it's, grandmas and adults teach the children. And one of the things that I've learnt with anything to do with natural remedies is that often it's the children that will teach us. So what is shingles? Because for some people it's a very, very scary disease and it sounds very, very painful. But what often happens is that people notice it just simply as a fever, or they get a little bit run down and tired. So it can start with a burning sort of heat or a tingling, and it can generally be on the face, but where most people find it is that they start itching here. And they go, I have no idea why I'm itching on my flank. And it's not till they've itched a few times and then they back up and look in the mirror and they see that they've got this rash all over their back, both sides often. The pain of that itching is probably more uncomfortable than the rash itself. And what happens with this is that you can have a dose of shingles and then it can be reoccurring again and again, especially when you get run down. So sleep is hugely important, and there's a lot of studies that tell us that, but what they mostly tell us is that if you don't have enough sleep, so this is a sleep-deprived parent as well as a sleep-deprived elderly person, is that you'll have multiple detrimental consequences through all the systems of the body if that sleep bank isn't well kept well up to date and with lots and lots of rest involved. So shingles, what can we do for oral preparation is going back to our sodium ascorbate. So it might be that it's taken once or twice a day, but if I had an itch and pain and discomfort, I would be pushing it right up to that bowel intolerance level, supporting it with the lipospheric vitamin C so that you've got both of them going through at the same time, which reduces that uncomfortable bowel, but it maintains that vitamin C level in your body. There's cod liver oil for families who have got that photophobia again, that vitamin A inclusion. And one of the best antivirals that I can think of, especially for this disease, is the olive leaf. Now, the only precaution with the olive leaf is if someone has low blood pressure, it can actually lower it a little bit. So it's better to have it if you've got an above or high, hopefully just a normal blood pressure. Now, St. John's wort is also known as hypericum. So hypericum is an ideal herb for anything to do with nerve endings that are frayed. So frayed as in stressed, uncomfortable, painful, damaged. But also when you think of hypericum, as a good herb for depression, it's also frayed as in I'm at the end of my nerves. I'm at the end of my limits. I'm so stressed and I'm so tired that part of what happens with St. John's wort is it nurtures the entire nerve ending. So don't always think of St. John's wort as just to do with depression. It's mostly used in the herbal field to do with any nerve ending disruption. So whether that be a mental, depression type thing, or whether it be anything to do with nerve pain. There's a homeopathic remedy called hypericum, which might be useful at this point, but that just depends on the symptoms. There's a remedy called passiflora, which is the passion flower plant, and that can be used for families or people who can't sleep very well. And then there's also a herbal tea, which is very high in silica, and it's the oat straw. Now, oat straw, when you think about it, is what horses are given to have nice shiny hair and nice shiny manes. And so it's also for that, the nerve endings, like the last part of the body, which is healing or growing. Now, I've mentioned rust tox with the chicken pox, but it's also ideal for any burning or itching or like people get driven crazy at night. They can't sleep because of the burning and the itching. So that's when you'd either have the homeopathic rust tox, or you could also paint the hypericum as a tincture on the back itself. Now, convalescence is critical for someone who has shingles, because if they don't look after that first initial shingles illness, then what will happen is that it'll reoccur again and again. And of course, it mostly reoccurs when their immune system is down. And so convalescence is a time when I would bring in the mineral salts, the cell salts, and calf salt particularly, but there's another 2 or 3 that you could use in addition to supporting that skin, supporting the nerve endings especially, but also bringing up that immune system so that it's functioning correctly again. Topically for shingles, showers rather than baths, because you want to keep that area moist and not too dry so that it will slowly heal over time. You can mist it again with the ascorbic acid, and I'm not sure whether you've got Manuka honey available. Yep, probably from us. So the Manuka honey is ideal as well, especially if this one here, you can see it's just starting to get a little bit gooey. So if you had the Manuka on that, what you do is it literally eats the stuff that shouldn't be there, and it cleans it up so that the wound can granulate safely and healthily on its own. And then here's another foot bath for someone who might want to have that as a way of healing instead of putting it on their skin, with lavender, chamomile, bergamot, and just sitting in the foot bath. It also, the thing about a foot bath is that means that you can't walk anywhere. You have to sit there for 10, 15 minutes, absorb those beautiful healing oils, and at the same time sit and meditate or sit and rest and sit and focus on the possibility of getting better easier. Now, this is from a website, and the reason I put it up is because what it basically says is there's some shingles facts here, that lots and lots of people are going to get them, that, the people that get them once, and then a lot of people, will get them more and more times. But what it essentially says is the main risk to getting shingles is when you have a weak immune system. So for any of you who are elderly, or for any of you who are concerned about elderly family, one of the best things you can do is to support their immune system with good health, vitamin C, good nutrition, connection. And that connection is about love, so someone cares. And keeping their immune system up is going to be more likely to reduce their chance of getting it than just simply being concerned about who they come into contact with. Now, just briefly about the vaccine, Gary Goldman, who, as you might know from yesterday, is also involved with Neil Miller and his research, he was interviewed, and he said that prior to the universal varicella vaccine program, 95% of adults experienced natural chickenpox, and these cases were usually benign and resulted in long-term immunity forever. And so what happened is, in 1999, some mathematicians got together and they worked out 2 things. One is that there would be an increase in chickenpox cases in adults where the complication rates are higher, And also there will be an increase in shingles. So that was 1999, and now 2017, we are seeing that actually shingles has become more of a problem than chickenpox. One, because it's not in the community so much, and if it is in the community, it might not be the wild chickenpox. It could be the vaccinated chickenpox. And so our rates of shingles are increasing to the point that now the fear has shifted from the chickenpox and it's moved on to that generation who possibly get the shingles. And I have a young friend who's 28 and she got the shingles. And what's interesting with that, it was sort of like, oh, bad luck. And it's like, no, not bad luck. Because if you had looked at the year previous to her getting the shingles, she had a very, very stressful year, incredibly stressful. And then lastly, I've got this lovely little slide that I found while I was just scooting around the internet. And it's a study that was done with a whole group of people who'd both had their shingles vaccine. So there were two groups of seniors, both of them fully vaccinated. And they had one group involved in Tai Chi and they had the other group not. And what they noticed with the Tai Chi is the Tai Chi increased the efficacy of the varicella vaccine. And they thought, how wonderful. And all I could read is when I read this was like, why didn't everybody do Tai Chi and leave the vaccine out completely? So when you've got a significant change in a group who've simply moved, breathed, connected, had that like-minded experience, socialized, all of those things that support our normal immune system, we actually don't need to rely on or to think that a vaccine is our only answer. And then lastly, this beautiful picture. I didn't have anywhere else to put it. But I just wanted to have these beautiful blue eyes and know that the connection between socialization and health care and being involved with family is probably just as important as being fearful and worrying about which remedy to take to mean that you don't have any of these diseases. So I'm happy for questions.
Hi, I just have two questions. You're near Australia where Carrie Bone is, and they have a product called Nervagesic. Have you seen it work?
I have. I know Kerry Bone from his books. We use them in our college, but I haven't any idea about the product itself. But Nervagesic sounds to me like a pain relief.
Yeah, it works on muscle and nerve pain. I thought it'd be great for shingles.
And it's probably got hypericum in it.
Yeah, I think probably he loves that one.
Yeah, he does.
And the second question, I know you're in a zone in the world, Australia, New Zealand, that's very highly vaccinated. Someone told me that they withhold child credits if you don't vaccinate, so you're voluntarily opting out. Are there workarounds? We're trying to find those out in California.
So first of all, really important point is Australia and New Zealand are very, very different. Australia does have a law that if you're receiving any sort of a benefit from the government, that you have to be fully vaccinated in order to access that funding. In New Zealand, we have none of those rules. It's not mandated in New Zealand. It's personal choice. And we have a very, very robust informed consent process which was developed in 1994 after we'd had some research in New Zealand where women were in a cervical cancer research program, but they didn't know they were. And so because women had died being involved in that research program, we very, very quickly created an informed consent process, which meant not only for any medical care, but specifically for vaccines, that if you chose not to have one, you could not be coerced, bullied, pushed, harassed, or talked into having it. So as far as being heavily vaccinated, yes, we are, and I only speak from New Zealand, up to about that first year. And that's when everyone's very compliant because they think it's the best thing to do. But I find that when a family has one or two reactions, or they're with a group and one or two reactions happen in the group, that's when they start to read. So possibly the second year of life, they're not quite as keen to vaccinate. For some. Or for the others, they keep doing it and just shake their head. Oh, I'm not sure what's wrong with this kid. Yes.
Do you have any advice about shedding from the shingles vaccine? I live with a housemate who I believe had the vaccine, and I'm going to need to ask her when she had it, because I came down with shingles at the end of last year. Now, granted, it was a very stressful year. Death in the family, had to move, but I'm just now realizing that that might have been a contributing factor.
It will have been, and sheddings with a lot of the vaccines, but with shedding, I always think, regardless of shedding, that if your immune system is well, then you won't get it. And what's really important about shedding is fear. So when we have families who they're not vaccinating, but they're too scared to go to playgroup in the pools in the library because of shedding, it's like you don't want to let shedding run your life. You need to trust that your immune system is going to do what it's going to do, invest in what will help it, and then just live your life. Yeah. Thank you.
What do you recommend to people with young kids who may never come in contact nowadays with this seems to be a very, it's harder to come by a chickenpox party these days, given, the current government.
And it's hard too to get a wild chickenpox party, because what it could be is a shedding chickenpox party. You don't want to go to that party. So, what do you do as an adult? I mean, it's really uncomfortable. Well, if you don't get it, you don't get it. Yeah. So it's, apart from, socializing and all the rest of it, if you don't get it, then I think it's important that that child finds out that they haven't had it, and this is what it could be if you get it later, because it's not a nice disease. Chickenpox as an adult, even probably less, nice than shingles as an adult. Yeah. But the fear, don't let them be fearful. Chickenpox, piece of cake.
My daughter got chickenpox at 5, and then, of course, gave it to her sister, who was 3, and her, or 2.5, and her baby brother that was 4 months old. And when you talked about breastfeeding, I couldn't breastfeed with him because I just wasn't producing the milk. And he got it pretty bad. And I was just wondering, is there a correlation in terms of over bundling where,
they need to sweat. So any skin manifestation, they need to have loose clothing on, and they need to sweat, because part of that sweating is also getting whatever's in their system out of their body. So that's Hering's law of cure as well, like to have access to allow the body to just do what it needs to do without any sort of suppression. So suppression with medication, suppression with clothing, suppressing with water from the bath. They need to be able to just, rest and sweat and let that, move out of their body.
Thank you.
I'm wondering if you have an opinion about using homeopathic nosodes as a substitute for catching the wild virus, because a lot of parents are concerned that their kids aren't going to get that benefit.
Yeah. So if they're using the homeoprophylaxis, then that would be definitely part of that program for them. And I think addressing the fear, as well as allowing them to have that option of if they wanted to use the nosode. So I think that would be a perfectly, reasonable offer. Part of the course, although we talk about, whether you vaccinate or not, and what you do if you get the disease, that we also include quite a big section on homeoprophylaxis, because the main part of my course, believe it or not, is informed consent. So although there's all this information, it's first of all, do you want to do this? Do you want to do this? Do you want to know about this? And then we can help you through if anything happens. Yeah.
Thank you.
If we had chickenpox and we breastfed our children, how long do you think that natural chickenpox antibodies?
The passive immunity is probably going to be about the first 6 months.
Oh, okay.
Yeah.
Really short.
Yeah, really short, because that's the most critical time. So, for example, whooping cough, all those diseases are really critical when they're little. But after that, it should reduce the severity of it if they're still being breastfed because of the other things in breast milk. But the actual passive amount of it is probably just in those first early months.
Okay.
Yeah.
Thank you.
Yeah. Any other questions? Thank you so much for being here.